We're a network based upon community partners and the 5 GP practices here in this area. So we work with the Limehouse practice, we work with the Chris Street practice, the 2 practices at Newby Place, Gough Walk and All Saints, and the Aberfeldy practice. And basically our work takes 2 dimensions really. One is about local services around long-term conditions. And what we tend to do with that is work as a team of 5 practices and make sure that we're connecting up, we're using the expertise in the network, and we're delivering better and higher quality services. We've also got another piece of work that we do, which is around prevention. And this is something that the GPs in this area are really, really dedicated to do. So we have a whole healthy lifestyles team. And we're also very keen to get GPs and local health professionals out into the community, talking to community members and making sure that their problems are heard and that they also get messages around their health, and those are made really, really clear. So the preventative side is really important, but also delivering high quality medical services is also key as well.
The Health Trainer Scheme is basically about getting people or supporting people to become healthier or improve their health and well-being, really importantly. And so what we do is we provide free or low-cost physical activity classes as well as healthy cooking, healthy eating workshops across the area, kind of locally in community venues, so they're very accessible for local people. But we also work with people on a one-to-one basis on quite kind of in-depth behaviour change around health as well, for those people that kind of struggle to make those changes to their lifestyle. Keeping healthy, one of the best things you can do is give up smoking. If you're a smoker, the best thing you can do for your health is to give up. Also eating well, so eating a very varied, very balanced diet is really important, and physical activity, so just doing enough activity to keep yourself kind of feeling fit and well is really important. And I think one thing that gets missed out around keeping healthy is kind of emotional health, and that's really important. So kind of making time for yourself and making sure you see your friends and your family is really important to support that as well. We have a dedicated resource within the team for people who may have problems with their mental health and managing their emotional well-being. So we have people who are qualified in mental health to work with people specifically. And we do kind of stress management workshops, and we work with people who perhaps are depressed or have low levels of anxiety to kind of increase their activity, eat well, and also utilise local services that are available that will also support that as well. So in terms of kind of giving up smoking, there's loads of options available for local people, and it really depends on kind of what they prefer. So for people who may be kind of really long-term smokers, they can get support from their GPs and their practice nurses in the area, and that can be with kind of medication, or it can be with nicotine replacement therapy. But some people also quite enjoy group work, and there are specialist smoking cessation teams within the area who provide quit smoking groups where you can kind of quit smoking with other people who have the same experiences as you. And they tend to work really well as well. So they will do nicotine replacement therapy, and you'll go to weekly sessions and kind of get support. But also health trainers in the area can support people to give up smoking as well. And they will do that on a one-to-one basis. So again, using kind of health behaviour change counselling, and again, nicotine replacement therapy if people feel that that's appropriate for them.
We're always keen to help and support people to stop smoking. In the surgery, we offer lots of different appointment systems. So we offer appointments morning, afternoon and evening, so people can come along, discuss how they want to go ahead of, with smoking. So for example, some people might want to try using a tablet, which is called Champix. Other people might want to try nicotine replacement therapies. We're really keen to support people to stop smoking because obviously it's the best thing they can ever do for their health. It's the most important thing they can do to help protect themselves in the future. It will help them financially as well. They'll save a lot of money. And also you're 4 times more likely to stop smoking if you get some help and support and some nicotine replacements.
There are really 2 main sorts of infection that we see in general practice, viruses and bacteria. Viruses, unfortunately, we don't have many treatments for, and often, but the good thing is that the body often gets rid of the viruses by themselves, and viruses cause coughs and colds and earaches and sore throats. Bacterial infections can be more serious and may require antibiotics, and they can cause an isolated severe sore throat, an earache which may have gone on for 48 hours or longer, or a bad chest infection. And often the sign of that is if you've got a cough which is bringing up lots of sputum associated with high temperatures, and probably doesn't have a runny nose associated with it, because that would indicate that it was a virus.
Temperatures are, obviously a common problem that you get with most infections, and it's part of your body's normal response to fighting infections. So temperatures in and of themselves are not a bad thing. But I think our sort of general guidance that we follow is if they're under 3 months, if the child is under 3 months old and they've got a temperature over 38, that would be an indication to call a doctor. If they're sort of 3 to 6 months, over 39 degrees would be, again, a cause for concern. And then older than that, there isn't much guidance regarding specific temperatures, but it's more about whether they have any other symptoms with it. So things like sort of drowsiness, floppiness, any other symptoms that you might be worried about that could go with that, diarrhea, vomiting, that sort of thing. But simple things like paracetamol, ibuprofen usually help with temperatures, but if the temperature isn't going down at all, it has no effect on the temperature, then that would also be an indication to call a doctor.
So we're into the coughs and cold season now, this time of year, and obviously parents are worried when their children are unwell. It's one of those things that is a natural thing that happens to children. All our children get coughs and colds. It's part of learning. It's part of the body's learning to protect yourself against those viruses that come around. What should we be worried about? Well, I think if you have a very high temperature, if your child is not eating or drinking, or if they're not going to the loo, going for a pee quite so much as normal, those are the sort of warning signs, or if they're just not themselves, those are the things that I would look out for. It's always good to have a thermometer at home, and if you measure the thermometer using the ear thermometer, that will give you an accurate picture of how hot your child is. They may feel hot, but actually their temperature in their body may not be quite as hot as you think it is. So I would certainly look for a temperature over 38 degrees, that's 38.0 on the thermometer, as something that I would be concerned about. And certainly if they're feeling a bit hot and you measure the temperature and it's between 37 and 38, then that's the time to start thinking about giving some paracetamol or some ibuprofen, some children's Nurofen.
Sore throats are very common, and most of them are caused by viruses, which means that they do get better themselves within about 5 to 7 days. The people that we would worry about, or the symptoms we would worry about, are if someone has difficulty in swallowing, so they find it quite difficult to drink water or fluids or even eating. If they have a sore throat with a temperature, so they've got a fever or high temperature, that could be worrying. And if they So if they've looked in the mirror themselves and they've noticed that they've got some white spots on the back of their throat, that can be something called pus, which is basically infection in the back of the throat. Those people we probably would want to see or contact, say by either face-to-face or a telephone appointment, as those people, for that it might be a bacterial infection which might need antibiotics.
Earache's quite a common condition for children to have. It's probably most often associated with having a mild cold in their upper airways, where it's difficult for children to breathe properly, and they're all bunged up, so they're all bunged up with mucus, and so that causes an increased pressure on the eardrums. It's not really a sign of an infection being in the ear, just have sort of mild ear pain, and it usually gets better with time when the cold gets better. So the first thing to do with a child from earache is simple treatments like paracetamol, but maybe to be more concerned if a child's got a big high fever and a temperature and is in a lot of pain, and the pain's not getting better with paracetamol or ibuprofen that you can buy over the counter. If any of those things were the case, then it would be important to see a doctor. But most earache will settle down at home with just some simple painkillers from over the counter at the chemist or the shop. Children often get sticky eyes at this time of year because it's caused by a viral infection, and there's lots of viral infections being passed around in the community. The majority of cases of sticky eyes are a viral infection, and so often don't need any specific medication. So antibiotic drops won't help because it's a viral infection, and often they're quite hard to put in, and children aren't very keen on it, and it causes stinging. So we often suggest just to gently bathe the eyes, get any of the stickiness out, and it usually passes with time. With sticky eyes, if your child goes to a nursery or goes to school, it's not a reason for them to be off or not go to school or nursery. It's a common, very mild infection, and it's fine for them to go and be in contact with other people. It's not going to cause them any great harm.
Vomiting and diarrhoea is very, very common and mostly affects the younger population, so young children and sort of toddlers. That's the main age, and it's very, very common because most diarrhoea and vomiting is caused by a virus and can be passed very easily between children. So if children are going to play groups and nurseries, it can be very easy to pass it between them. Now, the reason vomiting and diarrhoea is important is because it's, as I said, it's very common and can cause children to become dehydrated if they're not getting the fluids on board. And so it can be very important in terms of treating the diarrhoea and vomiting. Unfortunately, as it's a virus, there's no particular cure to making the vomiting diarrhoea go away. And the main treatment is to keep the child well hydrated during that time. Children can have whatever drinks they usually would have. So if a child is being breastfed or bottle fed, they can continue to have that. And in older children who are eating as well as drinking, the main focus is to aim to get them well fluid hydrated. So if they're not wanting to eat their normal food, then they can continue to drink lots. And although we wouldn't always recommend giving children sugary drinks, in certain circumstances when they're quite dehydrated, it may be that they need a bit of a sugary drink and may want that a bit more. The main things that you would want to look out for worrying signs of diarrhoea and vomiting is if the child was not themselves, so if they weren't playing or were more miserable and upset and had very high fevers that weren't being controlled with paracetamol. The other things to look out for is if the child was producing less wet nappies than they would usually. So if you were trying to give them fluids and they just weren't taking anything and weren't having wet nappies and weren't themselves with a high fever, that would be when you'd want to call the doctor.
Pharmacy First is a scheme whereby the patients can go to the pharmacy for minor problems. So, for example, for coughs and colds, for contraception a lot of the time, and they can get the prescription from the pharmacist without seeing the GP. And people who are eligible to get free prescriptions can still get that prescription for free as soon as the medication that they get is within a list that the pharmacist will have and covers all these minor problems. You sign up for a Pharmacy First card by going to the reception. They will give you all the necessary information that you can then take to any pharmacy, and they will sign you up and give you a little card that you can carry with you. And then any time that you have any minor problem that is covered within the Pharmacy First scheme, you take this card, you go to the chemist, and you get your medication over the counter without having to see your GP first.
Pharmacy First, this is a really, really cool and good scheme to get really involved in. What it means is that we in the practice here can give you a card, and really for a lot of simple conditions you can take a card, go to the local chemist, get good advice from a very skilled and intelligent pharmacist who can give you advice on pain for simple conditions like sore throats, for earache. And it also can give you medication for your skin, for mild skin conditions, even mild eczema. Can give you also medications for other conditions, can give you thrush cream and various different things like that. Really the thing is that it's at almost the same day immediate service where you can go and get over-the-counter medications free if you're entitled to free medications. This really means for children, they can get free paracetamol, they can get other free over-the-counter medications. And you can get it, go along, and it's quick and it's easy, and it doesn't mean coming to see the doctor.
Flu vaccination is a preventive measure so that people who are vulnerable should not suffer severe influenza pneumonia, basically, because people who are vulnerable, if they get pneumonia, it's very difficult to treat as well. That's why to prevent this problem, we are advising the flu vaccinations. Usually people are above 65 and people with heart disease, renal disease, and respiratory diseases, and some children also, like asthmatic children, it's advised. And even the people who are dealing in health professions, doctors and nurses, should also have it.
Flu immunisation programme has been running for several years now. It mainly has targeted people with chronic diseases or long-term conditions, as we call them now, such as diabetes, heart disease, and respiratory problems like asthma and COPD. But in the last couple of years, it's been expanded to include children between the ages of 2, 3 and 4. And the reason that they have included those children is because those children often get flu and then pass it on to grandparents and parents who've got long-term conditions and who get the flu and get it much worse and have more complications because of it. So the idea is that if we protect the children against flu and stop them from getting ill, they won't pass it on to the rest of the community.
Unfortunately, there are many crippling diseases globally, and we're fortunate again in this country that we can help protect children against these diseases such as polio, diphtheria and meningitis, all these things which cause really terrible diseases in children and also can end up causing disabilities for the future and unfortunately death. So we are, very, very keen that all parents should bring their children to have the vaccinations. There has been some media attention around things like the measles, mumps and rubella, but causing problems such as autism, but thankfully all that has been disproven now. So we're really keen that people are protected against these diseases.
So I'm going to tell you a bit about what we screen for in general practice generally, and that would there would be cervical screening, which is screening for cervical cancer. We don't screen in general practice for breast cancer, but we would recommend that all our patients go for breast screening if they are called, probably in a local hospital. And there is also bowel cancer screening as well, and that is, again, doesn't happen in the practice, but patients get sent a pack, and that we would advise them to do as the instructions say and send that pack back, having completed it.
The cervical smear test is something that's offered to all ladies over the age of 25, and this is for ladies that are sexually active or have ever been sexually active in the past, and it's to help protect them against cancer of the neck of the womb. So the procedure itself can be a little bit uncomfortable just for a few seconds. Most ladies that have taken smears on, they will often say, oh my goodness, is that it, once they've had it done, you know, because it's actually a lot less uncomfortable than they thought it would be. So it doesn't take very long. It's an internal examination which is done by a female, by a nurse or a female doctor. The results only take 3 weeks, so you will always get a letter telling you the result within 3 weeks. If there's a problem with the smear test, it is treatable. That's why we're doing the actual screening test. So you would be offered treatment.
Vitamin D is formed mainly when the skin is exposed to the sun, and it is an important vitamin because it helps us to build strong bones. And people who live in this country, because of the lack of sun, and also because even if there is a sunny day in the winter, we tend to cover up because it is cold, we don't get enough vitamin D, and therefore the majority of us have low levels of vitamin D and put our bones at risk. Therefore, what we do recommend is that people take supplements over the counter, and also change their diet to eat more food that is rich in vitamin D.
Diabetes is a major issue in Tower Hamlets. We have almost 12,000 people who have been diagnosed with diabetes here in Tower Hamlets, but the figure is the ones who have been diagnosed, but we believe that there are much more people who are undiagnosed.
The major concerns in terms of health in this area is the prevalence of diabetes. There's a lot of people with diabetes. In the last decade, we've seen about a doubling of the number of people with diabetes, and the biggest concern, I think, for me as a diabetes specialist is the younger and younger people that are being diagnosed. So what it's not just diabetes being a condition that can cause some symptoms, but it can cause some major medical problems for people in the future, in particular heart disease, eye disease, kidney disease, and these sort of things. It's the complications of diabetes that are the really worrying concern. One of the things that we try and do is to try and make sure that people have regular checks if they're at risk. So people who might be at risk are people of South Asian origin, Bangladeshi origin in the area, people who've got a very strong family history of diabetes, or if you've got other medical conditions such as heart problems and so on. So it's worthwhile certainly having a screening test. If you've got any symptoms that suggest diabetes, so feeling very tired, passing lots of urine, and losing weight, those sort of symptoms, you should always alert your doctor to those symptoms and get a check.